Good morning, everyone. Thanks for joining us today. We are super excited to host our first of a two-part series of the virtual symposium, which is focusing on programs and services for older adults in rural health. Our goal today is to explore community health and the resources in our Southeast Tennessee region. And we're going to focus on aging in Tennessee, along with the entities and programs which support older adults and caregivers. We have a great slate of people lined up today to help us with this task. And just as a reminder, I was going to give you a little bit of the run of the show. We'll start the morning with some opening remarks from myself, and then we'll progress through talking about older adults, ETSU's data dashboard and the multi-sector plan. We'll get in a little bit to dementia-friendly communities and talk about senior centers, and then our own area agency for aging and disability here in Southeast Tennessee. And we'll end right around between noon to 12:30, talking about some very important caregiving tools that are available. We'll take a break. We'll come back at 2 o'clock for a session that is a little more particular to rural health. We'll talk about the public health layout across Southeast Tennessee, and then hear from a rural community stakeholder as well as the Rural Health Association. And then we'll hear from St. Mary's Legacy Clinic, which is a mobile health program that's been in our Southeast Tennessee and East Tennessee region for years. And we're super excited to host them today. And then we'll close out listening to our faculty tell us about their expectations and how students can be involved in this program going forward. Most of you filled out a pre-survey, which we appreciate very much. There will be a follow-up survey after the fact. I have a feeling a lot of the questions that we asked on the pre-survey will be answered for you during these presentations. And finally, I just wanted to thank everyone for attending. We are so excited about this project and getting launched in the spring of 2025, which is coming much sooner than we all want to think about. So thank you for being here. I wanted to start today with just a few things to level set us. And any of you who have heard me speak in the past know that we always kind of start with a question about how old is old, because we throw a lot of older adult information around. We talk about data, we talk about services, we talk about senior centers, and by and large, people in audiences will ask, well, am I old, or is my neighbor old? How old really is old? And the answer truly is that it comes down to three different things. As a nurse practitioner and a provider, my focus is not really the date of birth. I need it to tell me that the person sitting in front of me is the right person as an identifier. It helps us with our demographics. But our main areas of focus include health, function, and activity. It's most important to me that people are physically healthy and emotionally healthy, but I want to make sure that they're meeting their desire for their function and activity in life, that they can get around safely, they're safe in their homes, and then they're doing things that keep their mind and body active. The next definition that I wanted to talk about was aging in place. You'll hear some of that today. Aging in place is the ability to live on one's own home or in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. 73% of people older than age 45 report the desire to age in place. So they would like to stay in their home, in their community for as long as possible and as independently as possible. That number jumps if you poll people who are 65 and older. 88% of them say that they would like to age in place. We know for people of all ages to age in place that we're going to have to provide some level of care and support, and that's going to be needed by both formal and informal caregivers. And that's why it's so important for us to work on a workforce that is competent in caring for older adults. It does require a lot of preparation and adaptation. As we all age, it's the one characteristic that we literally all have in common, is that if our heart is beating, we are aging. And we have to start thinking about things now to prepare for later in life. And in addition, we have to encourage our patients and clients to do the same. Part of that is not only the physical realm and worrying about preventative medicine, such as health physicals or shots or medications, but also those social determinants of health that most of you have heard all about. We want to be sure that people have equitable access to transportation, that housing is accessible, medical care is accessible, and that people have access to healthy foods, fruits and vegetables, things like that. If we don't address the social determinants of health, it's very hard for people to achieve that goal of maximizing their function and quality of life. So, the other thing that we always throw into our presentations is this idea of reframing aging. People are living longer, they're healthier, they're working longer. It is really important that we all collectively work together to help reframe aging and erase some of the stigma and bias and that ageism presents. So whenever we're talking or writing in our verbal and written word, we want to make sure that we avoid phrases that contribute to the stigma and ageism. So rather than saying senior, elderly, or silver tsunami, we try and substitute for older Americans, older adults, and use language that is more conducive to that idea of successful aging. Reframingaging.org has amazing resources, and those are available for everyone to take care of. So switching gears a little bit, there's usually a plan or a model for everything that we do, right? A reason that we do it, the evidence behind it. This past May, the strategic framework for a national plan on aging was released. It was a collective work from lots of experts in the aging community. Talks about the vision for America that values older adults, embraces aging, and recognizes that people have a right to live with dignity, make their own choices, and fully participate in society. So this is basically a summary of what I talked about. I encourage you all to read this. It is really good information, especially in the first couple pages, about our challenges, but the good things that are associated with aging as well. The 4 domains of the National Plan on Aging include age-friendly communities, coordinated housing and supportive services that increase access to long-term care services and supports, and that means community-based services as well, and then aligned healthcare and supportive services. So as we go through the day, I hope that you will see a thread that ties through all the different presentations. You'll see information on older adults and the data that supports our need to continue working to increase accessibility for healthcare and increase knowledge and education around chronic disease, but making sure people can age in place as well. So along with that thread, then you'll see us weave through the work that we're doing at the state level, and then we'll drill it down a little bit more to our Southeast Tennessee region. Just for a little note of history about age-friendly healthcare and the concept of interprofessional multidisciplinary care. So all of this has been historically evolving over really the past 25, 30 years. This is just a timeline that shows where we started with the National Academies back in 1999 when they published the first work to err is human, building a safer health system. This had a lot to do with infection control, raising quality standards in healthcare and in hospitals. And then there were several other sentinel works that have happened over the course of these past 30 years. We had the evolution of interprofessional education. We've seen competencies published. Many people do interprofessional education as well as participate in interprofessional practice every day. So interprofessional being a team of people that work together to address complex cases, specifically for our purposes in older adults and caregivers. There were also some papers that were published from the American Geriatric Society talking about the challenges associated with not focusing on healthy aging and driving us in a direction of making sure that we're promoting this idea of healthy aging and how to get that done. Kind of along the way, we've seen many publications and works from the Institute of Healthcare Improvement. They have done work around the burden of healthcare providers, around quality care, and have also contributed a great deal to this idea of an age-friendly ecosystem. And then finally, we get into some of the age-friendly in the past decade or so models of care. And we're going to talk a little bit more about that before we get started. So, the age friendly ecosystem is a cross sector collaboration between Trust for America's Health, the John A. Hartford Foundation, and the Institute of Healthcare Improvement. And basically, it lines out these 6 sectors or initiatives that come together to help form the age friendly policies, practices, and communications. We see that there's a healthcare arm, a public health arm. It's important to be age friendly in workplaces, as well as our home and community based services, and then across our cities and communities. And then also with education, we want to talk about age friendly universities and making sure that everyone has the opportunity to learn about um, and enjoy the opportunity for education and research. These are 2 of the models that come out of the age-friendly ecosystem, one on the left being AARP's 8 domains of livability for age-friendly communities. Each of these services are super important, and I think you can find elements of that in every community. But the idea is to build the physical and social environment so that our infrastructure in our communities is age and dementia friendly and conducive to aging successfully. On the right side, you've got the 6 C's for public health, or 6 C's for supporting the advancing health equity. And you'll see as we go through some of the models that use this approach to advance the health equity in our communities. The age-friendly healthcare system focuses on a framework which has expanded over time. This is the one that is published the most, which is the 4 M's, talks about what matters most, showing a focus also on mobility, mentation, and medication. There is an additional M for multimorbidity, and we like to talk about the C for caregivers as well. So we always want to think about that as we approach our older adults, and especially as we think about their care holistically. The age-friendly health system's aim is to follow essential evidence-based practices, not to cause harm, and then to align with what matters most for adults and family caregivers. And really, honestly, this should carry through across the lifespan. We should always be trying to align our care with what matters most to individuals and families. Next, I just wanted to offer an introduction for those of you who aren't familiar to the interprofessional collaboration core competencies. Our mobile health initiative, which is what is kind of spurring all of this information, will utilize an interprofessional model to serve people in the community. And as such, our faculty and staff will make sure that we're concentrating on those competencies which involve the values and ethics, teaching each other about the roles and responsibilities and honoring those as part of the interprofessional team, making sure that our communication is appropriate and that we apply values and principles for teams and teamwork. So why the interprofessional team approach? It is one of our best patient-centered care models. When providers consider each other's perspective, including that of the patient, the caregiver, we deliver better care. Lots of research has shown that it allows each of us to practice at the highest of our licensure. It reduces burden for those of us on the team because you have that support system around that team approach to help solve some of these issues. And especially in rural health and with caring for older adults, the needs are so complex. And it doesn't matter if you're talking about the physical health, the mental health, or the social determinants of health, it is complex. And it takes a team to help address all of those issues. When we use the interprofessional team approach, we see better outcomes, patient satisfaction, and less provider burnout. It's a high contributor to aging in place. And some of the challenges that we see are just fragmentation and lack of reimbursement models. So we want to continue to advocate for the ability to use that approach when we're working with older adults. So just a few notes about the mobile health program. Again, just to level set us all to get ready for the day. We will be purchasing and launching a mobile health unit in Southeast Tennessee. I've listed the counties below because they're difficult to read in this map, but we're really looking to focus on our Southeast Tennessee region. Those 10 counties that are noted will store the mobile health unit here in Chattanooga and then venture out each week to different communities to help provide services to the community and to provide support for senior centers as well. This is an idea of what the mobile health unit will look like. There will be an exam room on board, as well as a wheelchair lift, as well as a consultation area and a lab. A lot of people ask, does it require a CDL to drive it? And it will not. It's about 30 feet in length. And we're excited to get it here. We can't wait. So why mobile health? Because we know that it helps increase access to healthcare. It's convenient and easy for people in each county to access those services. And it's a holistic approach to care, especially with using that interprofessional model. And again, the reason that we're looking to do that, to use that interprofessional model, is to improve the quality of care of the people that we see and the groups that we serve, to really work through and make sure our systems are efficient and our processes are appropriate. And when you launch a mobile health program that's going to one place, that's important. But when you're trying to serve 10 counties, it's going to be incredibly important for us to use all of the tools that we have in our toolbox to make sure we're serving everyone well and that we're meeting the actual need in those communities. Through that, we should see enhanced health outcomes and the support for people aging in place, and that would include increasing patient safety as well, especially for those living at home alone. The different professions that we'll have represented at the beginning, we may add more as we go, include our community health nurses, primary care nursing, women's health nursing, occupational therapy, social work, public health, some specialized nutrition work, and then also we have support from our business college as well. Lastly, I wanted to be sure that we talked about the importance of making sure the work that we're doing is evidence-based and evidence-informed. And one of the really great things about this program is that the sky is the limit. We can be as broad or as narrow as we need to be, but being able to help promote and sometimes implement some of these evidence-based programs, not only for dementia, as you see here on the screen, but for all sorts of issues that challenge older adults, we're excited to be able to do that. And part of what we do is making sure that everything is evidence-informed or evidence-based. And so we'll be looking for programs with exercise, with chronic disease self-management, with home safety, medication reconciliation. There's a whole long list of programs that we should be able to implement based, again, on the community's desire and need. So how can you help? There's always has to be a call to action, and we'll repeat this at the end of our session today. But we're still really open to hearing and listening and want to know what are the challenges for older adults and caregivers in the specific communities that we'll be serving. Many of you work in these communities, live in these communities, advocate for these communities. Tell us what you know. And we know that that's going to involve not only healthcare issues, but social determinants of health. And then we also want to meet and help promote the different community resources that are present. Our goal is not to take over or take the place of healthcare or resources that are already in the communities, but we want to augment or supplement the work that's being done and support those efforts. There is a QR code on the screen. If you haven't taken our brief survey, this is just a community needs survey. So thinking about the county that you serve and perhaps some of the services that could be offered, or letting us know about services that are offered. This will be sent out in the follow-up email as well, so that you'll be able to fill that out if you need more time other than this morning. And then finally, we're hiring. We're super excited to be posting positions for an advanced practice nurse to work on the mobile health unit, as well as medical assistant and driver. And then we're also hiring for marketing, and that is for several of our grant opportunities. So check out the UTC's workforce page or employment page, and be sure to refer people if you know someone who might be interested in those positions. All right. I'm going to stop my share and then get ready to introduce you to our first speaker, which is Rochelle Roberts. And Rochelle comes to us from Nashville area. She works for the Tennessee Department of Health and has a long history of working with public health and older adults, caregivers. We lean on Rochelle for so much, but she's going to present today about older adults and caregivers and present some of the data that we should focus on as we move forward with this initiative. Thanks, Rochelle.
Thank you, and thanks for having me today. Today's symposium really brings attention to two key groups in our communities: older adults and caregivers who support them. As Tennessee's aging population increases, caregiver demand increases as well. The caregivers are the backbone of support, helping older adults age with dignity, safety, and care. And as the needs of both older adults and caregivers grow, we have to ask ourselves, how can we better serve them? And how can we ensure that every adult is supported and every caregiver has the resources they need? So Tennessee stretches 432 miles from east to west and 112 miles north to south, encompassing 95 counties, 6 which are considered metros, and then 89 which are considered rural. A drive from Memphis to Mountain City would take about 8 hours and 11 minutes. That's without stopping at Buc-ee's and all of our other pit stops along the way. The state's vast and varied landscape really highlights the importance of our customized programs and policies, as solutions effective in a metro might not work or be suitable for a rural region. And Tennessee is experiencing unprecedented levels of net domestic migration, with 83,000 people moving into the state in 2022. Our state's population is a little over 7 million, and approximately 1.22 million of those individuals are age 65 and above, making up 17.3% of our total population. So this map shows the concentrations of those that are 65 and up across the state. And we know that in the coming decade that the number of older adults is expected to exceed the number of children under 18 for the first time in U.S. history. This shift is really driven by the declining birth rates and then improvements in healthcare. And you'll see the higher concentrations in those metro areas. So from left to right, it's Shelby, Davidson, and then Hamilton, Knox, and Sullivan. Despite the demographic shift, Tennessee ranks 43rd in health outcomes for older adults. So older adults in Tennessee are experiencing elevated levels of frequent mental distress, chronic conditions, drug-related deaths, smoking, physical inactivity, and increased poverty, factors that increase the risk of developing dementia. And dementia is not a single disease or a normal part of aging. And instead, it's an umbrella term for symptoms associated with various conditions, including Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and then others, which could be Parkinson's, Huntington's, a mixed variety. These symptoms lead to a significant decline in cognitive abilities affecting daily life, independence, behavior, emotions, and relationships. In Tennessee, Alzheimer's disease is the 7th leading cause of death. It's also the 7th leading cause of death in the Southeast region. Targeted interventions could really prevent or delay 40% of ADRD cases, so Alzheimer's disease and related dementia. We know that about 20% of these are really genetically linked. So to support the estimated 129,000 individuals living with Alzheimer's in the state, there are 74 certified geriatricians. That's less than 1 allocated per county. So we know that the limited number of geriatricians and challenges faced by primary care providers, such as unfamiliarity with evaluation tools, time constraints, and reimbursement issues, highlights that urgent need for us to increase the workforce development and specialty recruitment. So this map correlates with the previous aging population density map, revealing the higher rates of Alzheimer's disease in those metro areas. So again, Shelby, Davidson, Hamilton, Knox, and Sullivan, with their larger older adult population, they show significant concentrations of Alzheimer's disease cases. Again, this trend highlights the necessity for targeting interventions and specialized care in these urban areas, but it really also emphasizes the need for increased screening and early detection in rural counties. We always say that 129,000 individuals with the diagnosis is probably an underestimation of who's actually living with Alzheimer's disease. I just want to talk about the caregiver a little bit more. So caregivers, whether they're family members, friends, or professional caregivers, play that essential role in the lives of our aging population. They often undertake a myriad of responsibilities, from medication management to coordinating medical appointments, providing emotional support, and then ensuring that the daily needs are met. Their tasks are not just about maintaining physical health, but also about nurturing the spirit and dignity of the person they care for. So I want you to meet Carol. Carol's a 62-year-old from Tennessee who really exemplifies many of our unpaid caregivers in our state. Carol is a non-Hispanic white woman with some higher education. She lives with her spouse and her mother, who has Alzheimer's disease. She recently quit her accounting position to handle her mother's day-to-day activities, including medication, meals, medical appointments. With an annual income of under $50,000, Carol's financial strain is compounded by caregiving expenses. Her spouse's salary is stretched thin, and without children or extensive support networks, she often faces these challenges alone. This information has all been pulled from the Burfus results that we have, and those are available for everyone's use. We have a special caregiver report too that'll be linked in the notes in this slide. And then when it comes to dementia caregivers, we have 369,000 unpaid caregivers investing 4.99 million hours in caring for family members of origin, so mom, dad, brother, sister, grandparent, and their chosen family, so they could be members of their congregation, neighbor, or close friend. And that investment amounts to an estimated $7.8 billion worth of unpaid care. And then we talk about our sandwich generation. So this is 47% of our adults in their 40s and 50s. And these individuals, again, often between 30 to 40 years old, find themselves caring for both their aging parents and then their own children. So imagine juggling or being in their shoes, juggling the daily demands of raising a child while simultaneously managing the health and financial and emotional needs of an aging parent. They face significant time and financial constraints as they strive for that work-life balance, their caregiving tasks, and then the personal life. The juggling act can really lead to considerable stress, impacting their emotional well-being and their overall quality of life. Oftentimes they face burnout, guilt, and anxiety. So just as a close and our call to action, I want us to continue to commit to working together to ensure that older adults receive the care that they deserve and that caregivers are equipped with the resources and support that they need. Together, we can build a future where aging is met with dignity, where dementia care is approached with empathy and innovation, and where caregivers are celebrated and supported in their vital roles. Our information is available on the screen. We would love to partner with you all or provide you with extra information or support. Thanks for your attention and dedication to this cause.
I appreciate Rochelle's presentation so much because it always gives us a great look and overview at the state of Tennessee. Just thinking about the number of people that are arriving in our state, the people that have been in our state and have lived here with their families throughout their lives. You know, these are important things for us to be watching as health and public health and organizations that support our population. It is with great pleasure that I would like to introduce Dr. Wang from ETSU. She is responsible for so many good things that are happening across the state, and I'm really excited for her to tell us a little bit about the work that she's done at ETSU and that the work that's been done around the state to come up with a master plan on aging as well. Dr. Huang is a research assistant professor for the Center of Rural Health and Research, along with work that she does through the Department of Biostatistics and Epidemiology. We're super proud that she focuses on infectious disease, spatial epidemiology, social vulnerability and resilience, the social determinants of health, and population health. So I'm probably the most excited person because I love data and I love aging. So I can't wait to hear what she has to present. Thank you, Dr. Wang, for being here.
Thank you, Christy. Thank you for having me. So today I'm going to talk about the Tennessee Multi-Sector Plan for Aging Data Dashboard. Where, yes, I am Qian Huang. I'm a research faculty at the Center for Rural Health and Research at ETSU. A little bit of background information. So Tennessee was one of the 10 states chosen to participate learning collaborative supported by the Center for Healthcare Strategies, CHCS. And then the learning collaborative was about a 10-month between July 2022 and May 2023. And then this process is to help state to learn about best practices and implementation effort from other states to work on the multi-sector plan for aging. And the state was, TennCare was responsible for putting this together, and was awarded from CHCS to develop an aging dashboard. And luckily we got that grant and to develop the multi-sector plan for aging data dashboard. So what is multi-sector plan for aging? It is a cross-sector state-led plan resources and transform the infrastructure and services for the aging population, as well as people with disabilities. And there are 5 goals developed for MPA, which are health and healthcare, caregiving, community choice, employment, volunteerism, community engagement, security, and protection. What's the role of the multi-sector plan for aging data dashboard? So we aimed to provide valuable resources for policymakers and communities. And we want to deliver some comprehensive data and statistics. And at the same time, we want to keep it user-friendly. So we had several aging symposium. And we presented our dashboard and collected feedback and suggestions and incorporate all the suggestions into our dashboard. And we try to use the dashboard to identify some disparities and monitor the progress and also measure some impact of the policies or interventions. And this is our landing page of the dashboard, and I will do a live demo later. And on the left side, we'll see some brief introduction, and on the right side, we have 12 tabs to show different information. And we also have a state summary, and this is the state information. And we also have the nation information across 15 years. You can compare among different categories. So here are some of the variables included in the dashboard. The socioeconomic, we have sex, race, ethnicity, household by type, marriage status, education, responsibility for grandchildren under 18 years. Since this is a very important indicator to measure their burden, especially during COVID time, because this will increase the risk for both the grandchildren and the grandparents of infections. And their disability status, the language speaking, employment, income, poverty. And for chronic conditions, we have 19 different chronic conditions across the state. And we compare the state with this national information as well. I will show later. So chronic conditions, we have like Alzheimer's, asthma, cancer, COPD, depression, heart failure, hypertension, etc. And healthcare access is a very important indicators to measure the quality of living for older adults, especially. So we have healthcare facilities, including like hospice, hospital, nursing home, ambulatory surgery treatment center. And here is our data source. Most of our socioeconomic data are collected from U.S. Census American Community Survey, ACS, and the chronic condition data we got from CMS, Chronic Condition Data Warehouse, and the healthcare facilities. We retrieved the data from the Tennessee Joint Annual Report, and the GIS strip file we got it from Census. We also listed additional resources on our dashboard. So it's kind of serve as a platform that provide information and external links to link to other related information. And here is some analytics for the aging dashboard. In the last year, we have over 570 unique users. So those users clicked over 1,000 times in total session, and each session they spend like around 3 minutes on our dashboard for each session. And this is our user worldwide and in the US. So most of our users are located in the US, and we do have some European countries. We have Africa, Australia, and Asia. And in the US, they spread everywhere, and mostly in Tennessee, and like Nashville and Tri-Cities, and those are the main locations of our users. And let's have our live demonstration. So this will be our landing page, and you can find the aging dashboard here. Again, this is on the left side, you have a brief introduction, and right side we have 12 tabs. Each tab is characterized by a number, a title, and an infographic picture. So the first one is the definition, additional resources, contact us, and citations. So for definition, we have all variables, and each of them, what's their definition and why this is very important in the data source. So this is sex, household by type, marital status, and chronic conditions, and why this is very important, and what's the effect could be, and some related literature about it. And we have additional resources, like I mentioned. So each one you can link to different things, like, for example, the Tennessee State Health Plan and Rural Health Dashboard and the contact information. If you have information, you can contact us, and citation. And we have how to navigate the dashboard. We have a short video to show how to read the dashboard. And we also have an infographic to show, okay, click here, select here. So we try to make it very user-friendly and easy to understand. And this is like how to go back to the collection overview, change to different tab, and you click each one, you will see detailed information. For example, the state summary. So this is 2017 to 2021 ACS data. And this is the Tennessee. You can have the age distribution, household race, education, employment, income, poverty, disability status, etc. And you can compare with the US as well. And you can compare across the different years. And we have more maps that shows population and sex. So the splash screen will show you where we get the data. And we have population and sex. And this is the population. And when you click it, you will see detailed information for the county. And at the same time, we will compare, you can compare with the US as well. So, and we have a pie chart to show the percentage of male and female. And Rochelle just shows the population, aging population density, which like mainly in Memphis, Nashville, and Sullivan County. But when in terms of percentage of each, a percentage of the population, aging population is a little bit different. And these are like, because they have a pretty big population, they have smaller percentages, but Sullivan County is they have both big aging population density and the percentage. So you can see the different distributions of aging population. We also have population projection 2030 and 2040. And we maintain the same legend, so you can compare across years. And you will see by 2040, most like a lot of the counties that will have a percentage of over 26% for the population 65 and over. And we have race, Black, we have African American here, we have white here, and you will notice there are a lot of missing data. This is like, I talked to US ACS people as well, and they said they suppress the information when the population number is below certain numbers. So it's very hard for like policymakers or community members to understand the county status without knowing the accurate data. And we will try, like, yeah, this is some like data limitation, especially in rural areas. We have disability status, we have poverty, information, English speaking, education, responsibility for grandchildren. Like, for example, you will see the county and the US. And I do want to show the chronic conditions. So we have how we get this data, and this data is from CMS, a chronic condition. And we have 19 different ones. We have alcohol, Alzheimer, asthma, cancer, COPD. Each one you can click and compare between the county and state. Hypertension, stroke, vision impairment. Vision impairment is something we added after, like, in our aging symposium to add more information. Okay, and I do want to show the healthcare facility as well. So for healthcare facility, it's interactive, but if you are only interested in ambulatory surgical treatment center, you can click this and you can click the data point and it will show the detailed facility ID, name, street and location. Detailed information here. We have nursing home as well. And you can see the detailed information. and the backdrop or congressional district. Yeah, this is the live demo. And so you saw some of the data you saw it's kind of not the most recent because the ACS data update every year around December time. So Rochelle and I talked about it, and they decided to help us fund us to expand and maintain the dashboard. So we will keep updating and expand the range of the quantitative data variables, make it updated, and also we will expand to more variables related to like Alzheimer, dementia, etc. We'll also incorporate a qualitative insight, such as some case studies, interviews, and then we will add some spatial analysis and community engagement tools for more comprehensive understanding. And we will also involve in more policymakers, community partners, and general public to improve the accessibility and the usability of the data dashboard. Thank you. This is my contact information. So if you have any questions or if you are interested in be a part of, like if you have any suggestions about data or suggestions about the feature, the function of dashboard, feel free to contact me. Thank you.
Thank you so much, Dr. Juan. I am just in awe of the amount of work that has gone into the data dashboard, and I've used it myself and find it very helpful. And I look forward to expanding it more as well. We did have a question about how the data helps inform legislative work, advocacy work. And you answered it a little bit when you talked about the data being suppressed, but are there ways that our policymakers are using this data to work towards advancing the care for older adults and caregivers?
That's a really good question. So this is an important tool to support the multi-sector plan for aging data dashboard. And the data limitation is one of the thing that we talk about a lot, but that's another, it has advantages and disadvantages. So we can use this to help promote the data sharing. This one will be added as a part of the livability index of the Tennessee state government. And this will like cover some information about the aging. And because you can see some data is missing. And then we talked to the commissioner, we talked to a lot of people at TDH or other state government. We show them, see that here is a lot of missing data. How could you help us, or can we help you to achieve and to find more available data and to make sure at least we can see what's the disparities. And this is an important step as well. And for I saw the chat to see how policymakers utilize this data to inform their decisions. We've talked to a lot of people about their policy making, and also I got an email from AARP some weeks ago. They asked me about some data, and so they can show this to other people that how we are doing in Tennessee and how they can change it. And that serve as a data platform that can have some evidence of the improvement.
And then how can we, as both academic and community stakeholders, help your cause? Are there ways that we can either contribute data, or if there's even if we just have questions about the data, what are the best ways that we as a community in Southeast Tennessee can help advance your cause?
That's a great question. Thank you for asking. And so if you have the data you want me to include in our dashboard, please feel free to send it to me, and I am happy to incorporate those information on our dashboard. For example, the vision impairment, actually we didn't have that data before, and it is Praise who is in the vision in the vision. She has those data. She helped collecting those data, and she think it's very helpful to include this information in the aging data dashboard. So she shared the data with me, and I added this information to our data dashboard. And so if you have some certain data that is not publicly available, but you want to share with us, we are very happy to do so, and we appreciate your effort and support. And also, if you have something functionality wise or even color wise, like I don't like this color, could you change this color to a different one? We're happy to do so if it's appropriate.
Well, it's really exciting to me if nothing else happens from today. And on that note, we are going to transition to Chelsea Ridley, who is also from the Tennessee Department of Health. And she is going to talk a little bit about dementia and then the importance of our community infrastructure to support persons living with dementia and their caregivers. Chelsea is a registered nurse. She has her master's degree in public health, also from ETSU, serves as the Department of Health Dementia Navigator Program Director, and has previously served as the director of the Civil Monetary Penalty Reimbursement Fund. She wrote and is overseeing the Tennessee's Building Our Largest Dementia Infrastructure Effort, which is the BOLD grant from the CDC. That's a huge win for Tennessee. And she is specifically very passionate about older adults and public health. We have a really great team of people at the Department of Health under the director, Sally Pitt, who are working very hard to ensure that older adults and caregivers have what they need. So thanks, Chelsea, for being here. We can't wait to hear what you have for us today.
Great, thank you. Hello, everyone. I want to thank Dr. Witt first for inviting me to speak about specifically dementia-friendly communities and the way community can influence the way we think about dementia care. As Dr. Witt mentioned, I am Chelsea Ridley. I'm currently serving as the program director for the newly developed dementia navigation program. And so today I really want to focus on ways that we can think about dementia care and some of the things that influence dementia care. So what influences someone's health? I know we have some students on the call, so I really want to take time to kind of highlight some of the things that influence our health across the lifespan. Because as we know, health early in life can impact our health as we age. So let's talk about some of those things. This list is not, of course, all inclusive, and it gets a little bit more complex as we think about individual health. But as some of the other individuals on the call have already mentioned, there are social determinants of health that influence health. There are specific behaviors that can influence our health. There's environmental factors that can influence our health. So let's talk a little bit about some of those health factors kind of early in life. And again, as we continue the conversation, how that influences later in life health and also kind of that community response to health. So when we think about babies, we also often think about, immunizations. We think about the parents' health. So Rochelle mentioned that caregiver or that sandwich generation caregiver. So we think about the parents' health. So are they caring for an older adult? What stress does that put on them to care for that child? Of course, drug use and pregnancy, so on and so forth. When we think about toddlers, we think about kind of early interventions, right? So, access to speech therapy. So that really gets to health access, allergy development, environmental pollution, so on and so forth. School age children, of course, quality of education, huge factor when it comes to dementia and kind of that brain development, right? Then we think about teens, and what that looks like. We think about traffic safety. We think about helmets, right? When we're playing football, when we're playing other sports. Adults, really, we start thinking about, again, that sandwich generation. So, what it looks like to care for a child, to care for an older adult, an aging parent, what it looks like to access health care. So do they have access to an emergency department? How far away are they from an emergency department? What does their insurance start to look like? And then our older adults. So we really think about, again, access to care. Many of our older adults have multiple chronic conditions. We think about kind of medication costs. Again, those individuals that might be experiencing memory loss, are they getting an accurate diagnosis? What type of access to specialists do they have? So all of these things influence our health. And whenever we think about dementia care, all of these things come into play, right? So it takes a community response. So I'm not going to go heavily into dementia. I know we're limited on time, but I do want to kind of provide an overview of dementia, what that looks like, and who the caregivers are in our communities. As Rochelle already mentioned, dementia in and of itself is not a disease. There are various types of dementia. As you can see, those are provided on this slide. This is not an all-inclusive list, but these are some of the types that we think about. With the most common being Alzheimer's disease. And so we often, whenever we talk about Alzheimer's and dementia, we also often say Alzheimer's disease and related dementias or ADRD. So Alzheimer's disease makes up about 60 to 80% of cases of dementia. There are several factors that play into the development of dementia or Alzheimer's disease. Individuals can live as long as 20 years after a diagnosis. Of course, that has to do with their other health factors. They can live much shorter, and usually is a little bit shorter. Things can influence how long they'll live, such as age, again, access to care, so on and so forth. Again, Alzheimer's is not a normal part of aging. It's a direct result of changes in the brain. And as we talked about some of those early in life things that happen. So a few risk factors for ADRD or Alzheimer's and related dementias. So of course, advanced age, there are genetic components that influence the development of Alzheimer's and related dementias. And of course, age being the greatest risk factor, but there are so many other things that can influence brain health, like I've mentioned. And again, some of those behavior-related risk factors and just lifestyle-related risk factors, individual health-related risk factors, again, smoking. So, of course, we know smoking is a risk factor for so many other chronic conditions, but including Alzheimer's and dementia. Physical inactivity, obesity in midlife, hyperlipidemia. And if you'll notice too, all of these are kind of connected to heart health as well. So who is more at risk? We've already kind of discussed that aging, social determinants of health, lifestyle related factors kind of influence our development for Alzheimer's and related dementias kind of later in life. But of course, there are also disparities that exist. So African Americans are twice as likely as whites to have dementia, and Hispanics are 1.5 more likely than their white counterparts. This may be due to the prevalence of other conditions such as heart disease and diabetes among these populations. And then among all races, women are 2 times more likely to be affected by Alzheimer's disease than men. And why? It's primarily believed to be that women live longer. And then again, some of those things to help reduce our risk for dementia. We like to say what's good for the heart is good for the brain. So fruits and vegetables, increased physical activity, managing blood pressure and diabetes, and quality sleep. So let's talk a little bit about why a community response is important. So a lot of things influence our health as we age, of course, and our health outcome. This group specifically challenges additional things such as, so these individuals face additional challenges whenever they're thinking about memory loss. So these individuals are more at risk for abuse and neglect. Caregivers specifically are more at risk for anxiety, depression, often have poorer quality of life and health outcomes. And of course, there's stigma and social isolation related to Alzheimer's and related dementias and caregiving. A lot of people still don't understand dementia and memory loss. And so whenever you think about that social isolation and how that can really exacerbate some of these other health-related issues like stress, and again, anxiety and depression, really, we're looking at a holistic approach to make sure that these individuals feel included, important, so on and so forth. So some quick facts about Tennessee. Over 1 in 3 caregivers provided care to a parent in 2019 and 2021. And this is all from the Burfus. Rachel already mentioned it's the 7th leading cause of death in Tennessee as of 2022. 1 in 3 caregivers reported spending 20 plus hours per week providing care in 2019 and 2021. And so when you think about how much time these individuals are spending caregiving and the impacts it has on the rest of their life, that can be pretty significant. So this community response, of course, is absolutely necessary. Whenever we think about what the community has to offer, it's pretty significant. So a lot of these resources will come not only from government entities, but also from things like faith communities. Think about the resources that faith communities often have. Whenever we think about healthcare, healthcare has a ton of resources, often charitable donations, in-kind services. Whenever we think about some of our other entities, such as nonprofits, a lot of them offer grants. So there are a ton of resources that the community has to support these individuals with memory loss and their caregivers. So what is a dementia-friendly community? So Dementia-Friendly America defines a dementia-friendly community as a village, town, city, or county that is informed, safe, and respectful of individuals living with dementia, their families and caregivers, and provides support options that foster quality of life. A lot of different entities can make up a dementia-friendly community, such as hospital systems, community spaces. So what does it look like to ensure that parks and libraries are conducive to individuals with memory loss and their caregivers? Businesses, what does it look like to make sure that your frontline employees can recognize memory loss and takes time to be patient and assist these individuals and their caregivers caring for these individuals. First responders. This is a huge one. Whenever an emergency happens and someone shows up, are these individuals in crisis, like a mental health crisis, or do they have dementia? Helping first responders understand what that looks like. Retirement communities. There are retirement communities across the state, making sure that staff and individuals in that community can help recognize memory loss and dementia in someone. So a community is holistic, and so much of what we deal with whenever it comes to dementia impacts our whole community. So in 2019, the Tennessee Department of Health developed a specific dementia-friendly community toolkit and offered some small grants to implement some of these efforts. UTC School of Nursing was actually a recipient. And so what do some of these dementia-friendly interventions look like? Of course, community education. We've already kind of mentioned this. A lot of people still don't understand dementia and what that means, and the impact it can have on caregivers. Of course, training at local businesses, engaging the healthcare system. So many of our primary care providers, research has shown, still don't feel comfortable giving that diagnosis because there isn't a cure. So making sure that our primary care providers understand the benefits of early detection or diagnosis. Again, providing free or low cost opportunities for these individuals and their caregivers to participate in the community. Raising awareness about elder abuse. There are tons of opportunities to become more dementia friendly in our local communities. And again, this can be done locally, it can be done countywide, it can be done in a local specific neighborhood. So there are tons of opportunities to engage these individuals and make sure that they are included in daily life. If anyone has any questions about dementia-friendly communities or how to ensure that these individuals are cared for and supported, please feel free to contact us. We are happy to discuss dementia-related issues at any time, and I apologize for my technical difficulties throughout this presentation.
Thanks so much, Chelsea. If anyone has a question, you're welcome to come off mute or enter it in the chat or raise your hand or whichever you would like to do. I have a question to start off the question and answer session, and maybe Dr. Juan can chime in as well. But often when we see data from across the state, it's always says the prevalence of Alzheimer's. And so is it in the background really a combination of all the different types of dementias, or is it specifically Alzheimer's disease that data is referring to?
Are you asking me that question, Christy, or are you asking
Either one of you, either one, whoever knows the answer.
So normally whenever we talk about Alzheimer's disease prevalence, it is a CMS measure. And for those on the call that aren't aware of what CMS is, it's the Center for Medicare and Medicaid Services. So of course they're providing insurance coverage for those 65 plus. And usually it is Alzheimer's disease and other dementias specific. I will say there are a lot of limitations to these data, right? So it does not include some of our Advantage plans. I mean, there are large gaps. So whenever we talk about prevalence, it is largely fee-for-service Medicare beneficiaries. And so there are tons of people missing from those data. So realistically, I think if we added in all of these other factors and data points, we would probably see an increased number in prevalence. But there are limitations, and I feel like it's important to kind of highlight those. And I know that we could really have a large conversation on ways that we could improve it. But right now, kind of the standard is using the CMS data. And anyone can chime in. Go ahead.
Thank you, Chelsea. And your presentation was very impressive as well. Everything she said was correct. And I just want to add a little bit more. So CNS, the way they count prevalence is calculated by taking the beneficiaries with the particular condition, in this case, Alzheimer, divided by the total population of the beneficiaries in their fee-for-service population, and then expressed by a percentage. This is how they calculate that. And the data we presented here are yearly owning the fee-for-service population and exclude the Medicare advanced enrollment and beneficiaries who are enrolled in any time in the year in like part one owning, A owning or B owning. They have several different parts. And so that will which kind of only have 60% of the data for all. So the Medicare Advantage enrollment covered probably 40%. So we have a big data, the missing data information here.
Thank you both so much. I think it's important to point out, I mean, one, it's always important to look at where the data is coming from and how we come to that data. And it's also important to note that when you're thinking about some of those gaps that we have, when we think about our 10 Southeast Tennessee counties, our prevalence is higher than 10% in each county. And so knowing that that's just a portion of the data that we have, you can expect that of older adults in your county, that prevalence is probably significantly higher. Then you also take into account the people who have not been diagnosed, who may be exhibiting signs and symptoms, or who have just, for stigma purposes or for whatever reason, have not reported their signs and symptoms. So there is plenty of opportunity to increase education and awareness and promote the importance of memory screening, encourage our primary care providers and healthcare providers, social workers, navigators, all these people, health educators across our counties to promote memory screening and that early detection and diagnosis. And we know that's important for so many reasons, not because of data. It's important to get people linked into community resources early, to make sure that people have the opportunity for interventions if needed, and to work on community services and supports. So it's not just about the data, it's about how we can serve people best. And that comes through all of us working together collectively for awareness and education. So thank you, Chelsea, so much for your presentation.
When it comes to data,
Yeah.
So the BRFIS, if anyone is interested as well, it specifically looks at subjective cognitive decline, which is self-reported for that survey. So if you look at the definition, they don't necessarily, these individuals that respond to the survey and what the data is looking at specifically is not Alzheimer's specific. It is basically, in a nutshell, memory loss that interferes with daily life. That's not the exact definition, but that is what it looks at. So whenever you're looking at Alzheimer's prevalence, for example, in a community versus what the subjective cognitive decline module is for BRFIS, those are a little bit different in how they're defined. So if anyone is curious about kind of those definitions, you can reach out to us or ETSU, and we're happy to kind of answer any of those questions for you related to what the difference is. It's also pretty well defined on the CDC website, and I think our website as well, maybe.
Thank you. Last chance for any questions around data, statistics, epidemiology, any of that good stuff. We are going to...
Yeah, I don't have questions. I just want to add one more thing about it, because she just mentioned BRFIS, and BRFIS, since it's survey data and it has sampling issues as well. So the rural areas, even though they try to oversample a little bit, but still rural areas is underrepresented in the survey data. And I really like one of your points. It's not just about data. Big data is a tool, evidence to support other decisions. It's not just about the data. we're doing everything to the health and well-beings.
Thank you both so much. Our next presenter is Sydney Ince from the Tennessee Department of Disability and Aging, which many of you know has a new name as of July 1st. And we are super thrilled that Sydney is here. I love doing these presentations as well because I learn so much from each of the speakers. But Sydney has over 14 years of volunteer engagement experience and service. She's the Director of Volunteer Engagement, helping recruit, train, retain, and recognize volunteers across all programs of the DDA, the Tennessee Department of Disability and Aging. She also has a teaching appointment at Indiana State University for nonprofit leadership minor teaching. She has a degree in recreation and support management, a master's in public administration from Tennessee State University with certificates in nonprofit management from both universities. She's a certified volunteer administrator, and she does a really great job across our state for helping recruit and train volunteers. And we're thrilled to death to have her tell us a little bit about that work today.
Awesome. Thank you all so much. I probably need to add into my bio that I'm also the Senior Center Liaison for the Department of Disability and Aging. So do quite a bit, as many of you do as well. I'm sure wear multiple hats. So today I'm going to talk about senior centers across the state and volunteers. So out of curiosity, I know if you scroll kind of toward the bottom of your Zoom screen, next to the chat button, there's the reaction button with a heart. So if you have ever been to or know of your local senior center, give me a heart or a thumbs up. And if you're brave enough, tell me the senior center in the chat box. I've seen a lot of hearts. I'm seeing some thumbs ups. For those of you who don't, I think I have a call to action that I haven't added, but we're going to call to action at the beginning and the end, right? Go see your senior center. So senior centers across the state are all very different. They offer a variety of services, programming, but a senior center that's in a more rural area may not have those resources that someone in a metro area would. So I'm going to tell you about a lot of the resources that our senior centers have, but I don't want you to go to the senior center and say, Sydney said you were going to have this and you don't. So it's very catered to the individual center and what they're able to do with the resources that they have. So one thing that a lot of our centers do is they provide meals, generally in a congregate setting. Depends on the center how many days a week those meals are served. So you might have 5 days a week, you might have 1, 3. If they're state funded, meaning they get some funding from us, we give that to our local area agency on aging and disability, and then they distribute that to your senior centers. They generally have a few more meals that are offered. We do have over 70 senior centers that are non-state funded. So they have their own resources, fundraising, things of that nature that may not have as many meals. But generally speaking, you can go to a senior center and you can get a free or low cost meal. You also have a lot of activities that you can do. So I love to say there's more than bingo at the senior center, right? There's also a stigma, or kind of a, not maybe a stigma, but a misconception that a senior center is also a long-term care facility or a nursing home. Two separate entities completely. So your long-term care facility, residential, someone, lives there, eats there, that's their home, right? A senior center, you can't sleep at. It's non-residential. It's your recreation center, more or less. It's a building that you go and you do all these activities. So some of our centers have art classes. Bingo is a popular activity. We have book clubs. There's Bible study. There's cards, games, like you name it. There's a bunch of different activities that you can do at the center. And our directors look to the participants to see what their interests are. So if you're a new member and you really want something that you've done in the past with friends, but you want to meet new friends, it's something that you can bring up to your center director to see if new activities can be developed and offered. A lot of senior centers do fitness classes, which is one of the most popular reasons why people go to the center. Generally, going to the center is free or low cost. Depending on programs, you might have a small fee, but our senior centers do the best they can to provide free programming to everyone who attends. So you have some things like chair yoga, or seated exercise. Some of us do Zumba and exercises like that. We also have evidence-based programs. So those are programs that are looked at by the National Council on Aging and the Administration for Community Living that is evidence-based. You're going to get certain results by attending so many sessions of these classes. So fitness and exercise programs are offered by a wide variety, a majority of our centers. And then quite a few of our centers take trips. A lot of our older adults transportation is a huge barrier to be able to do more things and get out in the community. Centers go on trips that might be within like a 30-mile radius. We just had a center come back in May from Alaska. We had centers go overseas to Ireland and Iceland, and there's many different places that you can go, whether it be local or, you know, if you're in Chattanooga, maybe you'll come up to Nashville and go to Opryland Hotel to see the holiday lights or something along those lines. So trips are also a big kind of draw to our centers as well. And I'm pretty sure, very confident, 99.9%, when you go to the centers, you're going to see something like this picture right here. You're going to see people smiling, laughing, just having a really great time doing a variety of different things. So if you haven't gone to your center, again, call to action. I would love to see you all go to your local center. There is a senior center in all 95 counties of Tennessee, so you can't miss us, right? Benefits to the participants. So if you have someone who is 60 and older, generally speaking, that's kind of the people we serve at senior centers through federal funding, but we do have a lot of centers who provide services to individuals who are under 60. So some of the benefits, you're going to get so many different resources. Think of a senior center as kind of a no wrong door to where you have something that you're in need of. Maybe it's financial support or your electric bill or just something like you're struggling with something. The senior center is going to be probably your first resource to go to. And if that director doesn't necessarily know the answer, they're going to talk to their local area agency on aging and disability, or they're going to contact me, and we're going to figure out that resource and some help for that individual. So go in there and trying to get as many resources as possible. Got a great socialization network. So a lot of our retirees, you know, you have that work family, right? You go into work, you have those individuals that you've talked to for decades, and they're kind of your friend group, right? And then you retire, those individuals are still working. So who do I socialize with, you know, in the middle of the day like I normally would? Go to the center, brand new group of friends that have similar interests that you do, especially in the particular programs that you're interested in joining. Such a variety of programs. I mentioned this before. If the center doesn't currently have something that you're interested in, don't discard it. Don't discount it. It's possible that those activities could be something that could be developed in the future. The center director just has to know what your interests are, right? If you don't tell someone what your interests are, how can we help provide something that would kind of draw you in and engage you? And it's really helped our participants engage back in the community. So they're not so isolated, especially after COVID. We're starting to get more and more people going out to the senior centers to be engaged, to be involved, to participate, you know, just be part of the community again. A lot of our centers, not only do they ask for people's support to come in and talk about benefits, we're going to talk about that in a minute, but a lot of our centers try and give back to the community. So they'll ask, you know, the local school system, hey, can you use any volunteers to help read to the elementary school kids, or whatever it might be. There's a big event in the community. Reach out to your senior center and see if you can get some volunteers from the center participants to see if they can help you all in the community. So not only just helping the senior center by doing things, but also allowing the center and its participants to give back to the community that they're in. So that was kind of to how the participants of a senior center can be benefited. So many of you, some of you might be able to be a participant in a senior center. Many of you might be parts of local community organizations, and we also need your help at the center. So something that you can do is maybe be a guest speaker. If there's something that you're passionate about, there's some data, Alzheimer's, dementia, all those good things. Our centers are always looking for educational programs, and those resources, again, right? Not only just pamphlets, but you know, Stephanie's going to come and talk about this great program, and now we have Stephanie's contact information. So the participants actually have a name and a face to a person who they can reach out to for those resources. Maybe you want to instruct or teach a class, not necessarily fitness, It's just the best photo I can come up with, but we're always looking for fitness instructors. It's kind of difficult. But if you have a fun hobby that you like, I'm a huge cross stitcher. I love to cross stitch. And if I had the time, I would go over to the senior center and I would teach a cross stitch course. But if there's something along those lines, always looking for new programming at the center. Sponsorships. Like I said, there's more than just bingo at the senior center, but if the center does bingo, they're always looking for local community sponsors. So you can come in, you call bingo, you can talk about your programs, and really be able to be interactive with those participants. And lastly, we would just love for you all just to spread the word. You know, just like what I'm doing for anyone who didn't have a heart or a thumbs up. I'm not going to call you out because I don't remember. But I spread the word to you. Please go see your senior center. For those of you who did have those thumbs up and those hearts, please be sure to spread the word that your senior center is available. It's there. We have great resources. We really want older adults to join, participate. Just go check it out. See if there's anything that interests them. So you're probably like, well, yeah, senior centers are great, but where do I find them, right? We have over 200 senior centers across Tennessee, and we have an interactive map on our website. So you'll click that link once Christy and everybody sends you the resources, and you can find your local senior center. Again, just to reiterate, all senior centers are different. You're going to get a lot of different activities at different places. So keep that in mind. And if you ever are struggling reaching out to anybody, please feel free to shoot me an email and I can make that connection as well. So switching gears a little bit to volunteers, just curious in the chat box, who do you volunteer for and why? You don't have to necessarily say our programs, though I will talk about the amazing opportunities that we have, but who do you volunteer with in your free time and why? I am an avid volunteer for Special Olympics Tennessee. I do their regional and state basketball tournaments. I do summer games. I do flag football. I love the organization. I love the athletes, the partners, the coaches, everybody. It's just a welcoming environment. RAM clinics, love it. I know other people do. Food RX, Food for Life programming, excellent. Who else? Or unmute yourself. Miracle League, local children, library for children's programs, Heart Health and Education, excellent. SHIP, State Health Insurance Assistance Program, getting that Medicare counseling. We're going to talk about that. Community School Council, excellent. Awesome. Thank you all for sharing because volunteering is so incredibly important. Here are some of the benefits that I'm sure you all are feeling when you volunteer. Gonna get that socialization, that social connection. You feel like you're more involved in the community, right? There is a statistic that I cannot find that I found years ago, so I'm hoping it didn't go away. Statistics show that people who volunteer later in life live 4 times longer than those who don't volunteer. Keep that in mind. And it doesn't necessarily say the amount of hours, but just volunteering and giving back to your community, whether it be one event, doesn't have to be, 100 hours a year or anything along those lines. But if you're giving back in the community, you're going to have a lot better kind of health outcomes. And, helps cognition. We're talking a lot about dementia and Alzheimer's. This is possibly something that you can use to prevent. We have some great quotes from volunteers and participants here. So you'll get this. I probably should have kept that up while I was talking so you could read those. But not only does volunteering help an individual's, self-esteem and all these things that are listed on the screen, but you're really having such a huge positive impact on those individuals that you're helping, whether it be one person, it could be a group of people. You just never know, just going to go do something, deliver a meal or something along those lines, the true impact and how you're going to make somebody's day. So we do have quite a few opportunities. If you don't have somewhere that you're volunteering and you want to volunteer here at the Department of Disability and Aging, and maybe our programs aren't right for you, totally fine. Feel free to reach out to me. I'm happy to provide some resources on other avenues for volunteering, not necessarily with the older adult population, but maybe you're interested in animals or children or something along those lines. We can help get you connected to a volunteer experience that will be worthy for you. So we have a whole bunch of things that you can help with. We talked about Medicare counseling. being an advocate for long-term care residents, providing rides, teaching that course, delivering meals. We do a report every year. So last year, we were able to help over 80,000 people with non-biased Medicare counseling and helping them do things like figure out what drug plan's best for them and things like that. Over 64,000 people went to the senior center to do recreational activities. Over 34,000 people were provided a free nutritious meal that was either delivered to them to their home or in that congregate setting at the center or other nutrition site across the state. And nearly 2,000 people were given a ride to an essential appointment or place they needed to be in the community because, again, transportation is such a barrier for quite a few older adults across the communities. The link down here is to our website. So if you're interested in volunteering for any of our programs, you can click that link and kind of just fill out a quick interest form. We do background checks, background screenings for everyone. Of course, safety is the #1 priority for us, not only for the people we serve, but also for our volunteers and our staff. But if you're interested, reach out to me. Let me know if you want some more details about our programs. We also do a report every year on our program's volunteers. So this is just kind of our 4-year data. Got to always have data in the report, right? And you can see we've steadily increased our number of volunteers, increased our volunteer hours. 2021, I know everybody remembers, we're coming out of the pandemic. A lot of new funding was coming in. We had millions of more funding from the federal government. So we were able to do more programs that were unfortunately pretty short-lived. And a lot of them have been discontinued. So that's why you see kind of that jump in older adults served. And then we were back down because of those specialized programming that we were able to offer. But our volunteers contribute over $17 million of in-kind contributions to our programs, our services, and our people. So we are forever grateful. And without our volunteers, it would be a whole heck of a lot harder for us to do all the great things that we're able to do. For anyone who works with volunteers, give me another thumbs up or a heart if you work directly with volunteers. Maybe you're a volunteer coordinator or just your program has volunteers and you get to interact with them on a regular basis. All right, we got a few. Excellent. So for those of you who are maybe interested in learning more about volunteer engagement and how to get more volunteers involved in your programs, maybe you don't have a volunteer component to your programs yet, but you're looking into it. We do offer a free volunteer engagement webinar series every month from January to September. So this week, actually on Thursday, is our last session, but it's free to anyone who is interested. We usually have guest speakers from across the country who come and talk about a variety of things volunteer engagement related. And we also do a free CVA, Certified Volunteer Administrator Study Group. Volunteer engagement is not a recognized profession. So it's kind of looked at as volunteer coordinators can do everything. You know, oh, we need this done, so we're going to have the volunteer coordinator do it. Or don't have a volunteer coordinator at all. And you have some staff who are also in charge of all the reporting and, you know, volunteers and just kind of everything lumped into one, right? So we started a study group for anyone interested in achieving their certified volunteer administrator credential. And we also started a scholarship for those who may need some support in the financial portion of paying to sit for that exam. So if anyone is interested in those things, please feel free to reach out to me. I'd love to bring you into the fold on all of our great volunteer engagement opportunities. And there's my contact information. I apologize, I went a minute over.
It was great. Thank you so much, Sydney. Please feel free to ask a question or put a question in the chat. We would love for Sydney to answer those. You have so much knowledge about all of this. One question that I had was, who normally funds senior centers? I know some of them are private, but for the public ones, my understanding is that they're primarily funded by the counties with some support from the Area Agency on Aging. Is that correct?
So we're looking at about a 70-30 split. So 70% of our senior centers are nonprofit organizations that are supported by, say, the Area Agency on Aging and Disability, some other grant funding, donations, maybe a little bit of city and county funding as well. The other 30%, so there may be like a 1% in there too, but the other 30% is state or county run. So the city or county employee is the director. They get a little bit, you know, they get those state city or county buildings and things of that nature. And so they have a little, I don't even want to say they have more support because it kind of depends on the nonprofit, right? But it's about a 70-30 split with maybe very small 1% that really is supported by donors, not necessarily private, they're still nonprofit, but they have that the donor is their main funding source and base.
Gotcha. Well, I think this information will be extremely helpful, especially as we hear in our rural health segment later on this afternoon about the challenges that rural health communities have and the opportunities that we have to promote awareness and get involved and promote information about becoming a volunteer. Even we always think about transportation and difficulty of getting around, and that is just accentuated so much in a rural community. So anywhere that we have the ability to promote some of these volunteer opportunities, we want to be sure and do that. Thank you so much for all of your work and for keeping everybody running strong through volunteer efforts. It's my pleasure to introduce to you Chastity Shaw. She is the Choices Program Manager at the Southeast Tennessee Area Agency on Aging and Disability, which, for fun, try and say that 14 times fast. It's hard even just one time. So Chastity has been with the agency for 17 years. She is a UTC alum, go Mocs, and she has her bachelor's in social work and her master's in education and school counseling. She's going to talk to us a little bit again about the area agency and the different services that they provide from that perspective. Thanks so much for being here.
Well, thank you. I appreciate it. I'm just going to piggyback somewhat on what Ms. Sydney talked about because a lot of our programs here at the Area Agency on Aging are under the umbrella of the Department of Disability and Aging. And then we have some that are under the umbrella of TennCare. So we do a lot of different things. I'll just kind of give you an overview of our agency and then maybe hone in on a few of the programs that are specifically for aging and disability. So we are actually part of the Southeast Tennessee Development District, or SETD, SETD, we call it for short. We have a lot of acronyms and a lot of different names that people call us. You can see here our statewide map that shows you all the different counties that we serve in Tennessee. This is divided up by the different development districts. I believe there are 9. Yes, 9. I always want to say 10, but it's 9. So we're the little orange area down here, of course, Hamilton and all the surrounding counties, including Polk, McMinn, Meigs, Ray, Bledsoe, Bradley, Sequatchie, Grundy, and Marion. So each AAAD, each development district covers a pretty wide area, as you can see. So who are we? We are a people-centered progress in Southeast Tennessee and Northwest Georgia. We elevate how we care, how we build, how we work by partnering with people in need. We work to improve the lives of those who live in the region. We cost-effectively provide staffing resources to local governments and deliver programs and services to the region. This forges a very unique partnership with local governments, creating a climate of success for individuals, families, and businesses. So we actually have 3 separate divisions within the development district, and we use a combination of local, state, and federal, and also private funds for these programs. There are 3 basic groups. Set Cares, excuse me, which is our aging and disability programs. Set Works, which is our career and workforce development. And Set Builds, which is our community and economic development. We do love to collaborate, so we use a lot of different resources and partner with a lot of other groups. This just gives you kind of an idea of some of the different partnerships that we have in our different groups. Of course, this needs to be updated. It still says TCAD, but that's currently the Department of Disability and Aging. It just gives you an idea that we do a lot of different things. So the mission statement of Southeast Tennessee Development, or SETD, is to elevate the region by caring for its people, building its workforce, and developing its economy. So the part of Set D that I work with is Set Cares, or the Area Agency on Aging and Disability. The mission of the Southeast Tennessee Area Agency on Aging and Disability is to help older adults and people with disabilities to live with dignity and choices in their homes and communities. Area Agencies on Aging, or AAAD as it's sometimes called, was developed as part of the Older Americans Act. Those were formally established in the 1973 Older Americans Act as the on-the-ground organization charged with helping vulnerable older adults live with independence and dignity in their homes and communities. And again, it lists all the different counties that we serve. You can go to our website, which is www.sedev.org, and you can read all about our different programs and services. So the core services that are offered through the Area Agency on Aging and Disability: we provide supportive services, nutrition, benefit counseling, caregiver support, health and wellness, and elder rights. So I'm just going to kind of go through each one of those and break them down a little bit further. Supportive services would include things like information and assistance. We do have a toll-free number that is statewide that anyone can call in just to get information, to perhaps get a referral to another outside agency, get a phone number for a place that might be able to help them with a specific need. So of course, if someone calls in asking about our programs, we're going to screen them for those programs. But we do get a lot of calls that are just for general information. So we have some resources we can provide. It could be that one person calls with questions about transportation, another calls about how to look for an assisted living. One may call and ask about where they can go to a local food bank. Community referrals ties in with information and assistance. If we get a call from someone that we think would be appropriate for another program, we're going to refer them out to those other programs. In-home services, that would be programs like our Options program. And Options is for those who are 18 and up who have a physical disability. It could be an older person or an adult with a disability, the idea being for them to remain in their own home, to have a certain level of independence, and to avoid institutionalization. So that's going to be a program that we would screen people for if they're needing help with things like bathing, housekeeping, meals delivery, or maybe they're just interested in getting a PERS button that they can press, if they live alone in case of a fall. So programs like that we would screen for and place that individual on a wait list. Transportation assistance, we do have a program in-house called My Ride. Some of you may have heard of that. My Ride is for individuals who are needing transportation to everything from doctor's appointments to community type appointments. Maybe they need to go shopping or go get a haircut, things like that. That does utilize volunteer-assisted transportation, so we're dependent on volunteers who are kind enough to sign up and offer that transportation to our seniors or adults with disabilities who need rides. That is for individuals 60 plus, and that individual does have to be mobile, able to walk with or without a cane or a walker to get in and out of the car. So it's not like a wheelchair accessible type transportation. There are those resources out there, but this is more for a person who just doesn't drive and needs a ride, and they may not have a family member who can assist them all the time. Then under nutrition, we do have our home delivered meals, or our Meals on Wheels program. That is for individuals who are 60 and up, who are not really able to cook hot meals. They may have some difficulty with getting to the store to purchase the food that they would need to prepare. In certain areas, we do have hot meal delivery that is delivered mostly by volunteers. And those meals are brought to the door hot, so it also gives us an opportunity to have a second set of eyes on that individual who may be living alone or their family members are gone during the day. And so it provides some level of companionship and just someone checking on them, as well as bringing them a nutritious meal. And there are some areas that may have the option to get frozen meals if they have someone that can pick those up, if they live out in a rural area. We also have our congregate meal sites. Most of them are at senior centers, and then there are some at different apartment buildings and things like that, where those who are able can go and congregate and eat their meals together. So it's a social setting for them. Like I said, a lot of them are in senior centers. So while the person is there doing the fun activities that were mentioned earlier, they may also sit down and have a meal together. Benefit counseling, that would be anything from help with SNAP applications. So anyone who's needing to apply for SNAP benefits, of course, they can do that through their local Department of Human Services, but we do have a coordinator that works within our building who helps if we have someone who maybe they've tried it before and they didn't feel like it was worth their while to get SNAP because they didn't get a lot of money per month to spend. So if we have someone who's 60 or up, if their assets are below $3,500, we can help work with them to deduct some of their expenses, medical care, things like that they're having to spend money on, medications and things like that, to see if we can help them increase the amount of money that they get on their SNAP benefit each month. Medicare counseling, or SHIP, I believe SHIP was mentioned somewhat earlier. There is a statewide number that people can call to get assistance with Medicare counseling. Maybe they need help to figure out what Advantage plan they should choose, if they need a supplement, whether they want a prescription drug plan or which type. So that service is offered statewide through a number that people can call. And then the Choices program, which is the program I specifically work with, and that's the one, of course, I know the most about because I do deal with that one every day. But the Choices program is a 10-care program, so it's funded by Medicaid, and that is for individuals who are needing help with long-term services and supports. Sometimes we talk about our services here at the area agency being almost like a pyramid. So people may start at the bottom of the pyramid because there's a lot of different things that they need, and maybe they're just looking for meals delivery or a senior center to go to. But as their needs progress, they may work their way up that pyramid. And I would say that Choices would be sort of at the top because it's for the person whose needs are the most intense. That it's going to be someone who essentially qualifies for nursing home level of care. So they do have to meet certain criteria set forth by Medicaid, both medically and financially, in order to qualify for that program. We help people to apply for Choices. We help educate people about Choices. Sometimes it's appropriate for them and sometimes it's not. So typically if we get a call, someone doesn't know exactly what program they want or need, but they're going to start telling us what their needs are, and we're going to, through our information and assistance person, we're going to help sort out what program might be best to point them in the direction of. So if they're interested in Choices, we'll walk through that with them, find out if they're going to meet the medical criteria for that. And then if not, we may point them more to the direction of our options program or our home delivered meals, for example. So for Choices, that is for individuals who are 65 plus and or physically disabled 21 and up, who have physical impairments to the extent that their ability to take care of their activities of daily living are pretty limited. So it's usually going to be someone who has to have a caregiver, who has to have some help with things like walking, transfers, toileting, and so forth. It's not for just minor needs like housekeeping or someone to drive you to the store, for example. We can also provide services sometimes through Choices for an individual who has dementia if it's to the point that it's starting to affect their orientation and some of their other activities of daily living. They do also have to qualify financially, meaning there's an income limit and a resource limit for choices because it is TennCare funded. The current income limit is $2,829 a month, and that's gross income. The asset or resource limit is $2,000. So the individual can't have assets above $2,000 unless they're married. Their spouse can have a bit more. And that does not count one car and their home that they live in. So those two things would be exempt typically. Once someone is approved for choices, if they go through the whole process and get approved, they are put on a TennCare plan, and then they're assigned to an MCO. So that would be either Blue Cross Blue Shield, United Healthcare, or AmeriGroup, well, WellPoint, now known as WellPoint. Whichever one they have, that MCO takes over at that point, and they're the ones who broker the services and provide the direct care through their network of agencies. So we're strictly in the role of information, counseling people about the benefits that are out there, and then helping them to apply and see if they're eligible. Caregiver support, we have a couple programs that are specifically catered toward the caregiver. One of those is the National Family Caregiver Support Program. That one is for a person who's an identified caregiver who is providing care for someone 60 and up, or of any age if that individual has been diagnosed with dementia. So the point of that being to provide some respite for the caregivers, to give them a break from their ongoing caregiving responsibilities. They may go to a support group. They may have some activities throughout the year that are helpful to them, as well as some respite coming into the home. Then we have the relative caregiver program, which is very similar, and it sounds like the same thing, but it's not, because the relative caregiver program is actually for adults who are raising children that are not their birth children. So it could be their relatives, but it may be a grandparent, an aunt, an uncle, a sibling, but they have basically taken on the raising of a child that's not their birth child. And so they need support, they need different services, different activities to go to. There's a wealth of different things that they do through that program. And a lot of them are seniors that are raising children. As we all know, a lot of children are being raised by grandparents these days. Health and wellness, we do have our senior centers that have already been mentioned, and we know a lot about those now, a lot of activities for our seniors to partake in out in our different counties. Evidence-based health promotions, educational sessions, and volunteer opportunities, which volunteer opportunities were mentioned beforehand as well. Some of the programs that we have that use volunteers are the Ombudsman, Long-Term Care Ombudsman, the Meals Delivery, My Ride, and SHIP, of course. And then as far as elder rights, which is our final section, that includes our public guardian program. So we do have, within our agency, we have 2 public guardians who are assigned by Chancery Court to individuals who have been deemed incompetent. So they are assigned as a public guardian for someone who doesn't have a family member or a friend who's willing or able to be a guardian for them. So they would be a conservator, and they help that person with all decision making. For the most part, it's medical and financial. So they're essentially a guardian for that individual throughout their life, typically, unless that is reversed in a court. Long-term care ombudsman, we do have a long-term care ombudsman here in our area who also uses some volunteers to help with her job duties. She's going to investigate any complaints, disagreements, things like that for individuals who are living in long-term care facilities. So that includes nursing homes, assisted living, and some adult care homes and things like that as well. And legal assistance, we do collaborate with legal aid. And so there is some funding through our agency that goes to legal aid so that when we get calls from people who are needing legal assistance, we can refer them over to legal aid for help. So if anyone's interested in making a referral or getting more information, they can call in our information and assistance line, which we have a local number and a toll-free number listed here on this screen. Again, we serve Bledsoe, Bradley, Grundy, Hamilton, Marion, McMinn, Meigs, Polk, Ray, and Sequatchie counties. If we get a call from someone who is in another area, we will help direct them to the correct area so that they can get some help. And again, you can go to our website to get information about how to make referrals. There's a referral form that can be filled out if someone's more comfortable with that rather than just calling in. But that's pretty much what we do here at the Area Agency on Aging and Disability. If anyone has any questions, I'd be glad to answer while I'm on here, but that is the end of my presentation.
Thank you so much,
You're
Chastity.
welcome. You're welcome. Thank you.
There is one question about, is there a potential for expanding MyRide to the some of the other rural counties, and what would that take? And then while you're answering that, I'm going to put a poll up about MyRide.
Okay. I think there's always the potential, but it's been kind of a start slow and expand slowly because it is dependent on volunteers. So you can't offer the service until you have developed a pool of volunteers who are willing to provide the rides. Mm-hmm. For example, Bradley County and Hamilton County are our main areas, as well as Sequatchie, where we are offering MyRide. But I know in Hamilton County, we need more drivers before we can take on more riders. So I know in Hamilton County, for example, they started in one area and slowly spread to other areas, trying to base that on need, because there are more needs in certain areas that might be a little bit, maybe they're not on a bus route. So yes, I think there's potential for those to expand. It's just kind of a slow going with trying to get volunteers. And I know during the pandemic, it slowed down some because a lot of people were probably hesitant to offer rides just because of the risk of getting sick potentially from taking someone in your car. But it's a constant thing that we're working on. We have people out volunteer recruiting and trying to find new drivers. So
thank you so much. So for those of you who took part in the poll, 62% of you guys answered the poll about whether you had heard of MyRide prior to this presentation, and it's split 50-50 down the middle. So again, we've called some attention and promoted some awareness of one of our great community resources and the need for volunteers in other communities so that we can expand that great service. All right, I am going to move along to introduce to you Matthew Zeraw. Matthew is coming to us from California. He is a Chief Caregiving Officer at CareVirtue, which is a research-based technology company built to support professionals and caregivers. He serves on also as the board member on the National Adult Day Services Association. He's a volunteer for Alzheimer's Association, and he is a former caregiver to his father, who passed away recently from advanced dementia. This is a really great tool. I hope that you all will, again, get some information from and look at implementing in some of your care and practice. So thanks, Matthew, for being here. We're excited to have you.
Yeah, good afternoon or good morning, depending upon where you are. Happy Monday. As Christy shared, my name is Matthew Zeraw. I am the Chief Caregiving Officer for CareVirtue. As she mentioned as well, we're a technology company. So I want to share with you a little bit about what we're doing. I want to share a little bit about myself, and similar to what Chastity was sharing, our technology is actually built to help support delivering resources to individuals based off of their individual profiles. So whether they live in McMinn or Greene County, whether they meet certain income thresholds, whether they have a need for support groups, CareVirtue is a great place to help coordinate that care between both professionals and older adults like caregivers. So just as a starting place, our focus at CareVirtue has really been around caregivers, and the average age of our user is over 60. So we're very focused on helping to support older adults Our research has been funded by the National Institutes of Health. And what we've learned is that as folks are trying to take care of somebody with a condition, there's actually this informal care network that exists and professional support that exists. And the average size for some conditions is around 9 folks. So just envision working on a professional team with 9 other people and not having some of the tools or support to coordinate that care. And what Care Virtue really does is help folks connect, communicate, and coordinate care. And you can see here, we believe that it does take a village, as the data would show with these 9 folks. We do have some peer-reviewed articles that I have linked here, and I'll make sure that anybody who wants this presentation can get it to look at some of our research. But really our focus is on helping older adults connect with other folks that are supporting the care that they need and the resources that are in their community. So I just want to focus a little bit on the Tennessee Alzheimer's plan. In specific, Care Virtue began our work really focused on dementia. As Christy mentioned, for me, this has been a really personal effort. My father just passed away 2 months ago with advanced dementia, and my mother was a caregiver for the second time in her life. She also was the primary caregiver for my grandmother, who passed away with vascular dementia about 20 years ago. So we have a special heart for Alzheimer's and dementia. As I mentioned, Care Virtue is useful beyond the walls of those specific challenges, but the Tennessee Alzheimer's plan really focuses on increased access to home and community-based services and the ability to create a one-stop shop to find information on services that are available. It also calls for providing information tools to educate caregivers. The third bullet focuses on increasing access to evidence-based interventions. You can see in the fourth and the fifth bullet promotes use of effective interventions and best practices, and then strengthen knowledge about care planning and related tools for people with all stages of dementia. So essentially what the Tennessee Alzheimer's plan states is that folks need to have a centralized place to get access to resources and to learn more about what they need to do to coordinate care. And this is where Care Virtue comes in, and we're helping folks like area agencies on aging. As Christy mentioned, I'm on the board of the National Adult Day Services Association. We're helping adult day centers. Care Virtue is a digital software that allows for professionals and older adults to coordinate on care and communication. And really our focus is on reducing burden for older adults. And I want to share with you one specific example of how Care Virtue does this. And I want to share a little bit about the platform as well. So again, going to what Chastity was just sharing with us, as we figure out the specific profiles of folks in our community and what their needs are, what are the best ways to share that information with them? How do we make sure that they have easy access to that information and that they can know what helpful resources are available to them? So part of our research earlier this year was focused on helping folks in rural communities in particular. And our target was, how do we actually deliver resources to them in a way that they can know about them and that they feel very strongly that they could access them if needed? And so this next slide, it's got a couple things going on, but I want to first walk you through this visual. So imagine a professional sitting down with an older adult, assessing the needs of what some of their profile is and what some of the things are that they might need in the community. Care Virtue then delivers personalized resources. And I included 3 examples here: respite, financial resources, and access to support groups that fit their needs. And as a result of our research earlier this year, we saw that 100% of the participants knew about resources that could help them with the specific needs that they identified, and that they also had quick access to those resources. And you can read some of the quotes that we had from our participants. One, that it was inspirational and engaging, and it was helpful to have everything all in one place. So how does this actually work? And what does this actually look like from an older adult's perspective. So I want to share with you what we've designed. We use a framework called behavioral nudges, which are centered in ways to alert our users on the software about changes and opportunities within the resources that they have. And so this next slide shares an example of what it might be like to be a caregiver. So you can see that there's 6 different boxes here. The first, actually, all 6 of them are delivered through email. And they really drive caregivers and older adults to utilize Care Virtue. And so we set up emails where you can welcome the caregivers to learn about ways to take care of themselves, encourage them to learn as much as they can as they're on their specific journey related to their needs. And then, as I was sharing in the previous slide, depending upon whether they need help in those 3 specific areas, respite, education, and support groups, they may or may not get these next series of emails. And what we do is, over the course of time, we set up emails that are delivered to folks, for example, who need respite. So in this case, Christy decided to send an email to send out some personalized respite resources in McMinn County, because we know that the folks who said yes, that they needed respite in McMinn, want to know what those resources are. They have it in email, and they also have it in their Care Virtual account. Secondly, back to the Tennessee Alzheimer's Plan, delivering education. In this case, it is the UCLA education that's available. That is delivered, again, through email and available in the Care Virtue platform for the older adults. These specific resources and this specific training can be whatever is most relevant to the needs of the folks in your county or in your community. And then the last 2 examples I want to share with you, we don't want to share information that's not relevant. So in this case, the person who's being served said that they did not need access to support groups. And so in this situation, they wouldn't receive information. And what we commonly see is that when somebody needs help, they're often given a pamphlet with a lot of general information, or there's an excess of information that's shared. This step here, where we're not sending information that's not relevant, really saves caregivers time and effort to focus on the most critical things that are important to them. And then lastly, I want to share that we have the ability to help coordinate care. We have an event calendar. There are reminders that are sent through email. There's a calendar that older adults and caregivers can see within their Care Virtue software, so they always know what's going on and have the ability to access that and are reminded of those important events that are coming up. So I'll pause here real quickly before I show you a little bit of the software. Are there any initial questions about how Care Virtue works, where our focus is, or some of the benefits that it has to you? All right, great. So I'm just going to share an example overview. This is a view from the professional portal of Care Virtue. You can see in this case, we have a caregiver. There's a person that's being cared for. We have the contact information. And then, similar to what I was sharing in the slides, we've identified whether somebody needs respite or whether they need access to a support group. And so as this happens, the caregiver's account changes to be dynamic related to those specific things. So you can see that we have different resource categories, such as respite and support group. Those can be easily filtered. And I apologize, that was not set up correctly. This is actually a respite account. So this favorite around a adult day center here in San Diego is an example. In your community, you can share the adult day services that are available, any in-home respite, any community centers. And so again, these are really personalized, and it becomes a specific resource area that caregivers can access to really understand and see what's going on. We also have this learn area. And in this learn area, you're able to upload any videos that you think are relevant. In the slides, I shared an example of that might be something like the UCLA dementia training, But if there's specific training that your organization has or that your organization wants to share, all of that can be uploaded into the Learn area. And then the last piece that I had mentioned earlier was the event calendar. So it's really easy to add events to help caregivers stay on track. We saw that we had a meeting for care coordination coming up on the 27th at 9 a.m. Once that's added on, caregivers get an alert. They do also get a reminder. And if the caregiver wants to put their own events on here, they're shown in a different color than what a professional does. And all this is intended to make it a lot easier to have that one-stop shop, like the Tennessee Alzheimer's Plan calls for, to help coordinate care, access to resources, and the ability to learn the things that are most critical for the individual to learn. The feedback that we've gotten from professionals and caregivers is that it's incredibly easy to use. It saves professional staff time and effort. And caregivers, again, feel like they're more supported because they have access and everything in one place. So as Christy mentioned, would love to help support your efforts in your community to help you deliver resources more effectively and coordinate care with the older adults that you're serving. So I will pause here and I'd be happy to answer any questions that you guys have.
Matthew, we have two questions. Before we start with those, I wanted to, if you could just clarify the difference in how a professional can use this platform to help the caregivers. So there's really two different perspectives that we're approaching. One is the caregiver, care recipient, and then the other is that of the care team, the people that are involved in the care for that person.
Yeah, great point. So a lot of the features that I shared with you are focused on how a professional can help support the caregiver. To Christy's point, there are also unique features that are available to the caregiver. Let me show you a couple of those as well. Just 1 second here.
I can kind of tell my story while you're pulling that up, but
yeah, that's great, Christy. Thank you.
Yeah, that's good. So, we care for some of our family members, and like a lot of families, some of my husband's siblings are out of state, some are in town, but we all work, we all have things going on. And so when one of our family members goes into the hospital, it's a really big deal for, it's important to our family to make sure that we're either there and present, or at minimum, keeping up daily with all the different things that have happened and advocating for our family member. And so we have found that this is a great tool for us to use from a caregiver perspective, because we're able to journal, keep all our calendar information in there. They're really, there are other apps out there, but one thing that this allows is to integrate a care team. So our home health nurse can be on it and let us know what time she plans on arriving. Because usually, as we all know with home health, the times can get kind of scattered. And so if somebody's trying to meet that person at the house to go through things, if the home health nurse often needs supplies and she's not sure if they've been delivered yet or not. And so somebody's got to check the mailbox, right? So there's a great communication tool that allows everyone to work together as a care team. So it's not just the caregiver and care recipient, but it can include your PCP, your home health nurse, your social worker. And that, I think, makes it a much more effective tool for caregivers.
Yeah, thank you for sharing that, and for your experience utilizing it. So a lot of what I shared was really focused on how Care Virtue can be a useful tool for professionals as part of that care network in ways that a professional can help to coordinate things. To Christy's point, there are a lot of tools that as an individual caregiver as well that they can utilize. So an example here is we have this journal where things can be shared. Having a great day today. And what's interesting here is that the feedback that we get from caregivers is this helps them be more effective coordinating with friends and family that are part of that informal care team. It saves them time from having to call everybody to share updates. And then also, you can see on this right-hand side, we have the ability to filter journal entries. What we hear from caregivers is that they utilize this journal as an area to track important information, and then they print this off and take it to a case manager, a care coordinator, a PCP, and they're able to share, what's happened over the last 90 days in my care, and what has gone well, and what are some of the challenges. If there's specific issues that they've been faced with, they can search for those keywords and filter on that. So these tools are very helpful kind of in that very informal care network outside of what a professional can do as well. So great point, Christy. Thank you for highlighting that. And you said there were 2 questions in the chat. Is that right?
There were. The first one was, do you find email to be a barrier for caregivers and care recipients?
We don't. So a couple things. Email is pretty ubiquitous. Typically, for companies who are sending emails, an open rate for an email is somewhere between 15 and 20%. And typically what we see with emails, for the example that I share with you, where we're sharing resources for respite in McMinn County, the open rates on those emails are close to 70%. So they're more than 3 times higher than a standard email that is typically sent. So folks are engaged with this. We do have the ability to also text folks. We've seen that to also be a very ubiquitous and very common form of communication, particularly in rural areas. And so in addition to those emails, we send a shorter version through text message. If somebody wants to receive those messages through text message, that way they can be alerted on their phone. And again, that's a really helpful way for us to stay in contact and coordination. Additionally, I would say if there are challenges with either email or text messaging, the information is still stored within their account. So CareVirtue is accessible on any device that has access to a browser. So that could be a mobile phone, that could be a tablet, that could be a desktop, like I was showing it on you today. And we're continuing to see increased utilization. There are a lot of federal efforts to increase bandwidth, but the ability to access CareVirtue from essentially any device that has a browser makes it very accessible to a lot of populations as well. So great question.
The next question is, have you considered collaborating with findhelp.org?
We know about findhelp.org. Part of what our focus is on is really working with organizations in a community to help identify the trusted resources that are available in their community. We have also built a broader resource library and learn library that could be utilized to supplement that, but really the focus at the community level to identify, we really see the experts being folks like Chastity was sharing at the area agencies on aging or at a faith-based institution in town who really know what the resources are. So we think they have some great resources, but we also believe that in the community, those known resources can be incredibly valuable, and that's where a lot of our focus is.
And then another question is, what is the percentage of minorities who use CareVirtue services?
Yeah, actually, I would say disproportionately high. So we work with a lot of organizations that are serving underserved populations. So as I mentioned earlier, our research is focused on underserved populations like rural areas. So we work with organizations in rural areas. We also work with organizations that are focused on serving non-white populations and Medicaid populations, Medicare populations. So we have a very disproportionately high amount of underrepresented folks who are utilizing CareVirtue.
And part of your research was specifically focused around that area as well, which is rare in the research world to really carve out and focus on those people in rural communities. Because I think it makes it that much more challenging with email and all that good stuff. The next question before we break here is how long does it take a caregiver to get started with Care Virtue?
It takes minutes to set up their account. And what we hear is that it is really easy and straightforward to learn how to use. That was a lot of our initial focus with the first grants that we got from the National Institutes on Health, is how do we make it easy to use Care Virtue? We nailed that. And it really is simple for somebody to get started. And as I mentioned earlier, the average age of our user is over 60. So we have designed it specifically for older adults to make it easy for them. And we've included those underserved populations to make sure that it's accessible beyond kind of the traditional profile of somebody who may be involved in research.
Thank you so much. I know that here in Tennessee, we are having a huge push in a good way for dementia navigators, case managers, social workers, people that are heavily involved in that caregiving space, and it's much needed. And I think this type of resource is something that can help not only, people on that care team stay in touch with everybody. There's nothing worse than calling one family member and having to call the next family member. And it just, in that sense of communication is so important, especially when we're talking about that interprofessional care that we hope to give. So we are working very hard to be able to offer this through our mobile health program, and hopefully we'll be able to, and that way you all will get a upfront and close assessment of how it works and help support caregivers. Thank you so much, Matthew, and to all of you for staying with us. We will be back at 2 p.m. And as I mentioned before, we will dive more specifically into our region, our Southeast Tennessee counties, rural health, mobile health, and then particularly the services that we hope to be able to provide. So I hope you all have a good break, and we'll see you back at 2 o'clock. It's the same link. Thank you so much.